Dr. Shamita, Dr. LaQuoya, Dr. Tiff, and today we are talking about how you can save money on your prescription. So imagine your doctor wrote you a new prescription and you go to the pharmacy to pick it up. You go to the counter, you give the pharmacy technician your name and your date of birth. They pull your prescription, put it on the counter, and then as they begin to ring you up, you look at the price and it says $500. What do you do? So what do we do first? So we're going to go through some of the options that can help save you money. So one option would be coupon cards. So GoodRx, you may have seen coupons about GoodRx card that I actually got in the mail. You can go to the website GoodRx and it should let you type the name of your medication in and which pharmacy you want to use, and then it will give you prices. And what I have found that even if your pharmacy is not listed on the website, you should be able to obtain the pharmacy billing information and still give it to the pharmacy and they can try it. So a lot of pharmacies, some pharmacies may not use GoodRx, but you can definitely ask. And then depending on if you're using a brand name medication, you can also go to their website and they may have savings cards for you also. You'll probably have to fill out a very brief questionnaire, and then they'll give you the billing information that the pharmacy needs. They'll need a BN, a PCN, and other group number ID. And you will print that out or show your phone to the pharmacy and they can enter that information in and it will save you some money. Things I want you to be aware of: this card says save up to 80%. So the keywords are up to. Those are the key words. So just because your prescription is $500 and you do the math, it may not, equal the up to 80%. So just keep that in mind. Also, you can use this even if you have prescription insurance. So there are different reasons why your copay may be high if you have insurance, and hopefully we'll get to address that at some point. So if you have prescription insurance, you can use this if your pharmacy accepts it instead of your insurance, but then you have to weigh out the pros and cons of using this rather than your insurance. Most of the time, or some of the time, using this card is more beneficial if you don't have prescription insurance at all.
So sometimes, not only just GoodRx, but sometimes the actual pharmacy itself have prescription cards on file that they will go ahead and use for you. So sometimes you may come there and you not even know that they've used a coupon. I like to call those super technicians who already know what is available for you. But I know, Mariko, you were talking about there was a time where you worked in a pharmacy, maybe an independent pharmacy where they had patient accounts.
Yes.
And so, in our planning, we were like, well, I wonder if some of these independent pharmacies still have individual patient accounts where you can pretty much say, you know what, just go put that on my tab. So I called around, I did like a survey, and I called around to 10 different pharmacies across North Carolina, because that's actually where we live, is in North Carolina. So I called around the different pharmacies, independents, just to see if there were some options. And so all of them said they do not have personal accounts anymore. The only thing the closest you can get to a personal account is basically giving them your credit card, and then they'll keep putting the stuff on your credit card, and then at the end of the month, they'll charge your credit card one lump sum for all of your prescriptions. That's the closest thing they have to personal accounts. But what they will do, at an independent pharmacy, they have a little more wiggle room than your regular box chains. So what they are able to do is probably give it to you at like the wholesale cost, which is basically the cost that they pay to get the prescription or get the medications themselves. So they'll actually go ahead and give it to you. If they pay $7 for that particular drug, they might give it to you for $8, because they do have to charge a little bit of the administration dispensing fee, but they will get it to as low as they possibly can. Whereas your big chains, they don't really have that wiggle room. They want to treat every patient the same. And so pretty much they can only charge you what the insurance spits out, or either they might have a cash price, and that cash price is pretty much set by corporate. So depending on where you might go, it may benefit you if you don't have insurance. It may benefit you to go to some of the smaller mom and pop independents, and a lot of them are more specialty as well. You're not just a number, you're not just a customer or patient that came in there, you're like family there. So that is one great advantage of going to an independent pharmacy as well. that may help you save some money on that end.
I wanted to add just a tidbit to that. Specifically, when you are shopping around for the best price, you want to make sure that you know what the actual medication is, the name of it, the quantity. There is a difference in price between the milligrams and the dosage, as well as the quantity as well. So make sure that you consider that as you're shopping around, because then you don't want to get to the register and the price changes because it wasn't correct to start with.
Yeah. It's funny you say that, because one of the things that I remember that some providers will do too is, so say you're on a 25 milligram dose, your provider can actually write a prescription for a 50 milligram dose to cut that in half. So it's not necessarily what we want to do, but that is another way that you can stretch your medication and save money, is if they prescribe a higher dose and just tell you cut that in half. So that's just a little tidbit there.
Can work at saving money there.
Yeah.
In addition to that, we were talking about some other alternatives, cost-saving alternatives that could help you out. One is getting in contact with your insurance company, and I'm gonna throw a little bone in there. There was a couple of episodes where Dr. Shamita was actually talking about the formulary. It's important. You can't keep a long list of everything that they cover, but specifically if you know the drug and what is being treated, what health conditions being treated, you can call your insurance company and say, hey, my doctor prescribed this, it's to treat this. What is on my formulary, and what would save me the most money? We were discussing earlier whether it would be cheaper to get mail order than to order from a pharmacy, and a lot of the times it is. Day supply is another thing that you would want to think about as well. So when I talk about day supply, there, from my experience, especially with Medicare patients 65 and up with the Medicare insurance that they have, you'd be surprised that 30-day supply can sometimes be the same price as that 90-day supply. And with older adults, they're on a budget. They're usually on a fixed income, and it's important, they're budgeting out ahead of time. So it's important to ask, not just with Medicare patients, but with your own private insurance as well. How much can I save by getting this 90-day supply? So two benefits from that, you get to save a little bit of money. And I'll give you an example of something that I experienced with somebody's insulin. They were getting a 30-day supply of insulin, and insulin can be expensive. He was paying about $30 or $40 a pop for just a 30-day supply, and I decided to do a test claim on it for 90 days, and it was $30 for a 90-day supply, right? So it's considering those factors as well when we talk about cost savings. The other is sometimes there are over-the-counter medications that can be used as an alternative, and that would be something to ask your pharmacist about. Obviously, there's no alternative to blood pressure medication, but simple things like creams and maybe allergy medicine, those sometimes are a little bit cheaper to just get the store brand over-the-counter rather than trying to fill your prescription.
Okay, and another thing I wanted to just add to that, patients can call their doctor's office too, or their clinic, and just say, hey, my prescription is so much, can you please prescribe a cheaper alternative? But then again, you do have to realize that when you call the clinic, sometimes your healthcare provider actually must be seeing patients, so they may not be able to respond right away. So then you can definitely contact your insurance, but just contacting your clinic and letting them know, hey, let my doctor know to send another prescription that I can actually afford, that may be helpful as well.
Yeah.
Yes, those are all great advice, tips, ladies. So let's say you've asked the pharmacy about using a coupon, GoodRx, for example, or you've asked them if they have their own personal savings programs that they offer to their customers. That didn't help bring the cost down. A lot of pharmacies are not doing the accounts and personal accounts anymore. So then you reach out to your insurance company to see if there is a cost-saving alternative for you to use. And let's say that still doesn't help you bring the cost down. So one last option for you that you can do is reach out to the manufacturer of the drug to see if they offer any type of patient assistance programs. So first you can use Google and you can search that product individually. So let's say you're on Eliquis, which is brand name only at this time. So that might have a high copay on your formulary. So you can go to Google the name Eliquis, and then use that to get to the company's website and see if they offer any type of a patient assistance programs. Another way you can assess this information is going to a website called needymeds.com, and we can put that information down in our description. But needymeds.com will list out all the manufacturers that you can go to, and it lets you know patient-assisted programs and medications they have under those programs. Now, once you do identify that a patient-assisted program is available, there are some steps involved. First of all, it is going to require doctor involvement. So your doctor will have some paperwork that they will need to fill out, and then you will also have some paperwork that you will need to fill out. This paperwork will first ask about your insurance coverage, and it will also ask about your finances. And some of these programs do have like criteria that you'll need to look into before you go through the whole process, because some are strictly geared towards uninsured patients. And then you do also have some programs that offer both coverage to uninsured and insured programs. So before you even go through the whole process of trying to get the doctor involved and filling out all the paperwork, I would suggest first making sure that you meet the criteria to even be part of that patient assistance program. So ladies, did y'all have any other?
Yes.
I had one also, because you brought up a good point. Sometimes you can go to your local health department, actually, also, if you're on a fixed income, or they go based off of, I know in Cumberland County in North Carolina, they go based off of income. So they will get your income, they will see what insurances that you have, and sometimes you can get the medication for free.
Certain organizations may have free pharmacies. The one that I'm thinking of, if you have no insurance, if you have nothing, not a lot of income, I don't know what the specific criteria is. If you qualify, you get all of the medications for free. But they do have a list of medications that a very small list of medications.
That they're able to get for free. And I'm glad you said that, because I know of two in the area actually that I volunteered for that are one called the Care Clinic. Not that anybody outside of North Carolina could know that, but they do exactly what you just said. You go and you provide certain information for them, and if you meet the criteria, you can go in there, and it's mainly maintenance medications that you're able to get for free. So you might be able to check locally in your local neighborhood to see if those programs exist as well.
Yes.
If you're in North Carolina, there is an organization called MedAssist, and they also help with prescription medication, but they really help with over-the-counter medications. There's a lot of different clinics or drive-through events that they have where you can actually go online and choose, I think it's up to like 7 over-the-counter medications. They'll bag it up and get it ready for you, and you can just come through the drive-through and they'll hand you your bag of over-the-counter drugs. And this is really important for times like this right now. So you can get like your acetaminophen, your cold and flu agents that you might need, vitamins and things of that nature for free. And that can save you money as well. So MedAssist, I think it's medassist.org. You can look into that and find out where their next event will be in North Carolina. And that's a great way for you to be able to save some money on your over-the-counter medications.
Okay. Well, this is going to do it for this episode of That Pharmacist Show. Please be sure to
Like,
share,
And subscribe.
Don't forget to comment.
See you later.